We begin this morning with the COVID pandemic as we head into the winter and a potential warning sign for healthcare officials across the country.
The U.S. is seeing a lot of positive signs, a decrease in COVID cases and an increase in the vaccination rate. Plus, kids can now get the shot and the borders have opened up to foreign travelers. But healthcare workers in a handful of states, including Colorado, are warning of a troubling development. They're treating the highest number of COVID patients since December of last year. Just a few weeks ago, like much of the country, Colorado was reporting a low COVID transmission rate and high vaccine turnout. But now 95% of ICU beds are occupied, 95%. Colorado's director of disease control last week described the toll that's taking.
Our healthcare workforce is burned out. And when we talk about beds, those are beds that are staffed. It's not just an empty bed. It comes with a nurse and a doctor and a respiratory therapist and all of the support services that ensure that care can be delivered.
Nearly 40% of hospitals in the region are expecting staffing shortages this week, and doctors are now racing to bring COVID numbers down as we head into winter. There are questions this morning about what's fueling this rise and whether the rest of the country should be concerned. NBC News correspondent Steve Patterson joins us now from outside UC Health in Aurora, Colorado with more. Steve, good morning. I know you spoke to doctors about the rise in hospitalizations in Colorado. So what are they saying is behind it?
Well, that's the question that is so confounding to health experts here in Colorado, because this state has done relatively well with COVID. More than 60% of the population has been vaccinated. Those numbers are increasing. Pretty low infection rates here in this state. And so the fact that we're asking basic questions about why these spikes are still occurring has been so troubling. And so now these health experts are throwing things at the wall, wondering if it's the seasonality of COVID, the fact that it's cold, so maybe people are more gathered together in larger crowds because the rules have relaxed. Maybe they're taking mask wearing less seriously. Maybe it's the issue of booster shots because immunizations have been less effective as this COVID crisis has moved forward. That is more murky. What is more clear is on the hospital side, because what's happening in Colorado is sort of a crisis of non-COVID patients. As life has returned to normal, we start to see the effects of that. More car accidents, heart issues, people coming to the hospital for normal methods. The healthcare population has dwindled because people have been so battered by this crisis, especially these healthcare providers that have been hit over and over and over again. And so a lot of them have simply quit. And then one of the biggest factors that we've heard is that people have been delaying care. In other words, when we've had these spikes, some of the operations, some of the normal checkups that people would get have been put aside or delayed, mainly because people have been so hesitant about COVID itself. And so doctors are warning that that has to stop or this ripple effect will continue. I spoke to a doctor with the Colorado Hospital Association about just that. Here's what she thinks is happening. Listen to this.
We are seeing significant hospitalizations due to acute or critical manifestations of delayed care from a few months ago, as well as chronic disease burden that has been with our community for some time. On top of that, we're seeing a significant increase in the COVID-19 transmission in our communities over the last few weeks. So those two factors, so the delayed care from months ago and now the rise in cases of the Delta variant of COVID in our communities is very much putting a lot of pressure on our hospitals.
And of course, we should say that all of this made worse by the fact that still people are not getting vaccinated. Most of the hospitalizations and most all of the ICU hospitalizations are from people that are unvaccinated. Joe?
Steve, quickly on this last point, we've seen healthcare workers in hospitals under the strain of having too many patients. Colorado has a system in place to address that, but officials there are still concerned, right?
Yeah. I mean, it's a system that they've never had to use before on this level. We're at Tier 3 now, which basically allows for the transfer of patients more easily, the transfer of information a little bit more easily. There's also been a number of executive authorizations given by the governor's office to allow for that and to prevent, in some cases, those cosmetic surgeries or elective surgeries in this case, because they are at such a crisis level here, Joe.
All right. Steve Patterson. Steve, thanks so much.
Let's now bring in Dr. Hamish Adalja for more on the latest COVID headlines. Dr. Adalja is a senior scholar at Johns Hopkins Center for Health Security. Dr. Adalja, good morning. Always great to have you with us. So let's just start right there. What do you make of what's happening in Colorado? And are you concerned about what it might mean for the rest of the country? Is this early winter warning sign?
This virus isn't going to go anywhere. This has established itself in the human population, and we know that other coronaviruses do exhibit this seasonality. When it gets colder, when people are packed together, there's going to be increased transmission. And there are parts of the country where they were relatively spared from that Delta surge that we saw in the South and engulfed many parts of the country. So there's different timelines for this virus in different places, plus seasonality. And the fact is, there's still a lot of people that are not vaccinated, especially those with high-risk conditions that maybe aren't 65 or 70 years old, but maybe they're 50 years old and obese. And that's what we're seeing get hospitalized. So the solution to Colorado's problem is still getting more vaccine into people's arms, especially those at high risk for hospitalization, because that's how you keep your hospitals out of crisis, is by having your population as vaccinated as possible. And that's going to be the norm for some time.
And then, Doctor, of course, what happens after you get those shots? Now we're talking about boosters. So Pfizer says they're seeking to get approval to administer boosters for all Americans. Do you think that we're at the point where boosters are just essentially necessary for everyone? This is either 3 doses or 2 doses if you got J&J?
I don't necessarily think everybody benefits the same from a booster. It's clear when you look at the data, people above the age of 65, people with high-risk conditions like the immunosuppressed or people with diabetes, asthma, lung disease, and those individuals who got the J&J vaccine, that's where there's actually strong data that the benefits of the booster are really striking. It's the general healthy population. We're unclear what we're really trying to do, I think, with boosting, because we don't prevent them from getting hospitalized because they're at so low level risk of getting hospitalized. But maybe you're just pushing a breakthrough infection longer into the future, and maybe there's a second generation vaccine that might be better at that. So I don't think boosting healthy people to prevent mild infections is the best use of the vaccine.
Now, let's also talk about something else from Pfizer. They've secured approval for the use of their antiviral COVID pills in the UK. Can we expect to see those pills come to the U.S. anytime soon? And do more of these pills signal a potential end to the pandemic? I mean, how impactful could these be?
They could be tremendously impactful because not only do these pills have the ease of administration that they can be given orally at home, they prevent you from needing hospitalization and prevent you from dying. That's really extraordinary for antivirals. And I do think it really shows what this virus is going to be like in the future, that it's going to become much more manageable and treatable with oral antivirals. And these are slated to be reviewed by the FDA, and hopefully we will see them probably by the end of the year or maybe early next year. And it would really be game-changing if we had a simple, easy oral pill that could keep people out of the hospital. It just makes it much better when we have more tools to use treating COVID-19.
Dr. Adalja, as always, thank you so much for your expertise and your time.
This morning, the probe into the January 6th Capitol attack is intensifying. The House committee investigating the insurrection has subpoenaed 6 associates of former President Donald Trump. They're accused of helping him try and overturn the 2020 election. In a statement, committee chair Benny Thompson said, quote, "The former president's closest allies and advisors drove a campaign of misinformation about the election and planned ways to stop the count of Electoral College votes." He added the committee wanted to know every detail about their efforts to overturn the election, including who they were talking to in the White House and Congress, the connections they had with rallies that escalated into a riot, who paid for it all. So far this morning, none of the 6 has responded to NBC News' request for comment. NBC News Capitol Hill correspondent Leanne Caldwell joins us now with more on this. So, Leanne, who are the 6 who were served in this latest round of subpoenas, and why did they receive them?
Good morning, Joe. So these 6 are people who are extremely close to the former president, and they were also instrumental in trying to get election officials, either in Congress or in state around the country, to overturn how the people voted. And so this is a chunk of subpoenas that could be very instrumental in this committee's investigation. They include people like former Trump top campaign advisor Bill Stepien, one of his top communication aides, Jason Miller. It also includes John Eastman, the conservative lawyer who wrote that 2-page memo outlining a 6-step plan for former Vice President Mike Pence to overturn the election results on January 6th. Now, these subpoenas are an indication that these people have not cooperated, but we are waiting to see if they actually will cooperate. These subpoenas went out just yesterday, Joe.
Yeah, so Leanne, I mean, we know former President Trump has been urging his ex-associates not to comply with the committee's requests. Do we know what happens if they don't cooperate?
Well, we've seen what has happened with Steve Bannon. He refused to cooperate. He's the only one so far out of more than 24 or about 24 subpoenas that have gone out who has not cooperated. And the committee acted swiftly. They recommended to the House of Representatives to refer his case to the Department of Justice for criminal contempt. And they've already done that. The House already passed that. And so that could be in store for these people who don't cooperate. Now, they do have some time. They do have until the end of November to hand over documents, and they have until mid-December to show for deposition. So they still have about a month in most cases to decide if they're going to cooperate or not, Joe.
And quickly, Leanne, on this last question, big picture, where do things stand in the committee's investigation? Could we expect more legal action going forward?
Absolutely. What we're hearing about are these subpoenas. That's the news, that those are the people we know the committee are trying to get information from. But they have already spoken to 150 people, not only in D.C., but around the country, who are cooperating. So this investigation is moving forward, Joe.
All right, Leanne Caldwell, as always, thank you so much.
Now, more than a dozen lawsuits have been filed against Travis Scott and the organizers of Astroworld after 8 people died at the rapper's Houston festival. The deadly crowd surge also left dozens injured, including a 9-year-old boy who remains in a coma. As officials investigate the incident, Scott and festival organizers announced they will be giving full refunds to all Astroworld attendees. Scott also said yesterday he plans to cover the funeral costs for the victims. The youngest one was just 14 years old. Joining us now is NBC News legal analyst Danny Savalos. Danny, good morning. So let's talk through some of these lawsuits that we just mentioned. What are they alleging Travis Scott and the concert organizer did here?
Believe it or not, crowd crush cases actually happen fairly often in the United States. And almost universally, the allegations in a civil case are negligence, and more specifically, premises liability. Arguing that these people who paid money to come here are what the law calls invitees. And when you have an invitee on your property, you owe them the duty to protect them from known risks. And that's why what the concert organizers, the venue, and even arguably the artist, what they knew in advance will be critical in deciding whether or not they breached a duty to these invitees, these concert goers.
And so, Danny, we also have this report from the New York Times. It shows that Houston police chief, his name's Troy Finner, who knows Scott personally, actually, met the rapper in his trailer before the show to express concern about the energy in the crowd. He said during the previous Astroworld Festival back in 2019, 3 people were injured when crowds overwhelmed staff and rushed the entrance. How could knowing about that conversation, if this did happen, as it did according to the New York Times, prior to this crush, factor into a civil suit?
I saw the sheriff's tweet, and I understand that he's trying to make the point that he raised this issue. But really, if we're talking about the potential liability of Travis Scott, that falls into 2 different categories. Number one, does Travis Scott, even if the sheriff meets with Travis Scott, he's the performer. The question arises, where is he on the spectrum of people who are responsible for concert security? There are arguably folks who are ahead of him on that spectrum. But separately, and I must make this, must emphasize this, even if he had no responsibility as to security, if he did some affirmative act, if he actually did something to incite a crowd surge or a riot or anything like that, he would be separately held responsible. And in that case, potentially even criminally responsible, depending on what he did.
And now, Danny, something else that's getting some attention is the fact that Travis Scott seems to have a bit of a history with issues at his concerts. In 2017, he was actually arrested after encouraging fans to rush the stage at a concert in Arkansas. That incident left several people injured. How will that affect this lawsuit, if at all? Does it, having this kind of pattern of behavior?
This prior pattern affects this lawsuit, at least against Travis Scott, if and only if Travis Scott did something to encourage people to surge. However, these prior acts are significant to place notice on the people who organized the concert. Hey, were you aware that Travis Scott does this, that he gets people all riled up at a concert? And if so, what did you do special to make your security at a Travis Scott show different than it would be at, say, a Barry Manilow show or a Billy Joel concert? More my speed.
And Danny, now this isn't the first time fans have been injured at concerts. I mean, things like this happen. You just mentioned that lawsuits even happen more frequently than we might be aware of. But the fact that 8 people died here, it's of course getting national attention. Do you think venues and artists will start implementing new safety and security measures as a result, especially particular concerts, as to your point there, that have this type of energy are known to, like maybe more medics on site or something like that?
I hate to play comparative tragedy, but decades ago, we had the Great White Concert in New England where 100 people died, partly due to a stampede after a fire. So you had fire and the stampede that killed 100 people. So we've had concerts since time immemorial. There have always been crowds there. Crowds sometimes surge, more likely at some concerts than others. And that's why you have such a patchwork quilt of case law on the topic in the United States. So they will continue to happen. And until the courts figure out who is primarily responsible and impose, we have almost no statutes, no municipal laws on the topic of crowd control at concerts. So this may be a wake-up call finally.
All right, Danny Ceballos, as always, thank you so much.
Jurors will hear more testimony today in the trial of the men accused of killing Ahmaud Arbery. This follows a tense day inside that small-town Georgia courtroom. NBC News correspondent Ron Allen joins us now from Brunswick, Georgia. So, Ron, yesterday, jurors saw graphic photos and heard from the first police officer who arrived on the scene. What were the big takeaways? What can we expect today?
Well, we see how the prosecution is trying to make its case. They're using the police officers who arrived at the scene first and the interviews that they did with the defendants to try and recreate what happened and to try to show what the intent of the defendants was or was not. You know, the case is really two versions of what happened. We know what happened. The question is why it happened. On the one hand, Arbery, the prosecutors are arguing that Arbery was an innocent man jogging through the neighborhood and that these defendants attacked him, hunted him down and attacked him. They're claiming that they saw this man who was suspicious. They were trying to make a citizen's arrest and they had to shoot him in self-defense. So the prosecution spent some time trying to knock down this citizen's arrest argument, especially in the case of Mr. Bryant, one of the defendants. Here's how they did that by questioning one of the police officers. Take a listen.
Did Bryant ever say he was trying to make a citizen's arrest of Ahmaud?
No, ma'am.
Did Bryant ever say he was trying to arrest Ahmaud for criminal trespass?
No, ma'am.
Loitering?
No, ma'am.
Burglary?
Didn't mention it. No.
Attempted burglary?
No, ma'am.
Aggravated assault?
No.
The prosecutors are trying to show the jury that these men allegedly were not involved in a citizen's arrest. They were just out to hunt this guy down and attacked him and killed him. Joe?
Ron, that officer also talked about why he didn't try to render medical aid to Arbery when he arrived. What did he say about that?
He said that when he arrived, he didn't think he could do anything for Arbery, that he was already bleeding out, and that he was being the first officer there, he was concerned about his security. He had no idea what was going on, what had happened, so he felt like he had to focus on the wider situation than trying to render medical aid. And he said that he didn't have the training to do this. It didn't go over well with Arbery's family, his mother, his supporters. They felt like more should have been done to save his life, to try and save his life. Joe?
Yeah, Ron, I mean, today's day 3 of the trial. Arbery's mother also says she's been frustrated with the pace of the trial so far. What's she saying about that?
It's been going slowly because the attorneys are arguing about a lot of things. A lot of this has to do with what the defendants said at the crime scene. So they're looking through police reports, they're looking through interviews, and they're picking apart what can be said by one and not the other. And remember, you have 3 defendants being tried at the same time. So the attorneys have tried to separate out what one said, the other. There are all kinds of rules about incriminating another defendant, so on and so forth. But it's very frustrating for the family. They've been waiting almost 2 years for justice. So here's some of what she had to say about the pace of the trial. Take a listen.
Here it is in the middle of the trial. They're coming in with these, all these emotions that are just wasting time. They had time enough to prepare for this trial, and now that we're in the midst of it, I don't see what's looking for.
The judge had said it would take 2 to 3 weeks. we're in day 2 now, so we'll see. But yes, for the family, it's an agonizing process. Again, the bottom line is they've been waiting so long for their attempt to get justice, and the case is going to be filled with a lot of very graphic video, graphic pictures, because that's how the prosecutors are trying to recreate and show the jury what happened, and show the jury the horror and the humanity of what happened as well, because obviously that's what they hope is going to convince them to convict these 3 men.
All right, Ron Allen. Ron, thanks so much.
After a 200-day mission to the International Space Station, 4 astronauts returned to Earth aboard a SpaceX capsule overnight. Look at that, splashing down in the Gulf of Mexico. Now, while on the International Space Station, the crew completed 4 spacewalks to install new solar panels on the station. And get this, they also collected the first ever space harvest of chili peppers. Their trip home took only 8 hours, and SpaceX plans to send the next crewed mission to the space station as early as tomorrow. Look at that. All right, now let's get a check on your morning news now weather. Janessa Webb is with us today as Bill Cairns continues to rest up from his marathon. Hey, Janessa, good morning.
Hi, good morning. Bill only ran, 26.2 miles. We'll give him another day, right? And he's going to be enjoying all this sunshine. And even for the mid-Atlantic, if you're in that section of the country, you're starting to see a few clouds, but today is the day. We're seeing warmer air making its way in, and it's all due to high pressure. It's coming from the Gulf of Mexico, and that's going to continue to push that warmer air. Now, temperatures across the area, we are about 10 to 15 degrees above average in most spots. Look at D.C. today, 73 degrees. You cool off just a bit in the upper 60s, but we should be in the upper 50s to lower 60s across most sections of the Northeast and Mid-Atlantic for this time of year. So we stay above average for at least the next 36 to 48 hours. Then you'll start to notice a pretty significant change. Even Chicago for today, upper 50s in most spots, and the humidity, it's still in place across the Tennessee Valley. So that's a nice treat compared to all the cooler weather that we've been dealing with. But it's vital you enjoy it, because behind this is a very strong cold front. It's going to bring widespread snow across the Great Lakes, and then temperatures will drop about 15 to 20 degrees as we go into your Friday, into the weekend. Look at Chicago, Savannah, and Joe. By Friday afternoon, they're back in the lower 40s.
All right. Oof, look at that. Janessa, thanks so much. See you next hour.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.